Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Thanks very much. Hi again, everyone. Welcome to our Thursday Community Service Report here on KGAF. Today, Muenster Memorial Hospital Day. Very happy to have a new person from MMH in a brand new department, if you will. And we're talking about the new Respiratory Therapy department. And the director is Andrea Hendershott. How are you?
Hi, how are you doing?
I'm doing great. It's great to have you here. I guess before we get started with particular questions about respiratory therapy at MMH, tell us a little bit about yourself and how you got into this business.
Well, I was born and raised in Louisiana, and I moved here to Texas. Love Texas. I have been a respiratory therapist for 18 years. I started out working at the VA as a volunteer, helping with patient care. Loved working with patients. Really is a passion for me. Went back to college and became a respiratory therapist and have been doing it ever since. And it's been my love.
And boy, I can say something about finding something you love and sticking with it. It's very easy to do. For those that don't know, maybe there are some out there, I presume there are, that really don't know what respiratory therapy is. So kind of give us a general nutshell definition.
Well, respiratory therapy is a field of work that specializes with the lungs and the heart. We do education. We work with our COPD patients with breathing exercises. We work with patients that have trachs and also with ventilators. But most of ours is education and treatment of patients with heart and lung disease.
All right, and for our listeners, the Respiratory Therapy Department at MMH is less than 2 months old now.
That is correct.
You really just got it off the ground. How did you wind up in Muenster doing this?
I live in Crum, and a friend of mine had said, hey, there's a job in Muenster. You ought to look into it. I think you qualify for it. So I looked into it, and I said, wow, this is a cute little town. And I just fell in love with the town immediately. And I applied, and I interviewed, and I just love the hospital. It's such a wonderful small place, and it grabbed my heart immediately.
Well, that's great. And how is it getting a brand new department off the ground? That had to be a little bit challenging.
It's a little bit challenging. You start out with having very little and having to figure out what to do with what little you have, and then we've grown. We've had to order all of our supplies and products that we need, all of our education materials, and interviewing all of the therapists and hiring therapists as we've gone along in the last month.
All right, talk about your staff. How many do you have in your department?
Currently, I have 2 full-time and 3 part-time, which is an as-needed basis. I am still hiring, and so for those therapists that are out there looking for jobs, I'm still looking for 1 or 2 more PRN people.
All right, sounds good, and it's great to have this addition to MMH. Let's talk a little bit about specifically about some of the services that are offered in respiratory therapy.
Okay, so currently right now we do education. That's mainly our education for COPD and asthma, and also our smoking cessation retreats that we do with each and every one of our patients who smoke. We do inhalation therapy, which is nebulizer and MDI therapy for your inhalers, and education with those. We do CPAP and BiPAP therapy, people who have home CPAPs and home BiPAPs. We work with them with their home units. We also can bring in our own units and work with each one of those patients. We do work with our emergency ventilation and support, so if they've come in off of the ambulance, we work with them at that point. We do stress testing. That's cardiac stress testing with or without medications. We do EKGs, that's inpatient and outpatient. We do draw for arterial blood gas, and we do analyze that at the bedside, so it only takes 2 minutes, and we're excited about that. We do what's called lung volume therapy, where we practice breathing exercises and making sure that we're getting full capacity lung volumes every day, 3 to 4 times a day to prevent pneumonia. And then we also have oxygen therapy.
I want to talk about the lung volume therapy. We know that's so important, especially people coming out of surgery and whatnot, but it's really important for all of us. How do you teach that? Just give us a nutshell about how you go about teaching somebody that.
Well, we give them a device to practice with. It's called an incentive spirometer, and most people who come out of any kind of surgery will get one of these in a main hospital, and they will also get one in our hospital. And we have them take a long, strong, deep breath in through the mouthpiece, and as it goes up, we watch to see the volume that they achieve. And each person has a predicted value according to their height and their age and whether they're male or female. And so that determines the predicted value, and we strive to meet that goal.
Yeah, and for those that have just come out of surgery, I know, I speak from experience, that's not a fun thing to do, especially folks that have had, open heart surgery or something. It's hard for them to do. And you folks, I know you can't make it easier on them, but you can coach them in how to make it a little easier in the long run to get that breath, right?
That's correct. We do work with them. We work with them every day. We do anything from pinching their nose and nose clips to actually doing the breathing exercises along with them. So as they breathe in, we breathe in. As they blow out, we blow out. And it helps to encourage them. We also give them positive reinforcement and let them know that it's okay if you don't achieve your goal, but you're on your way. And we watch every day to make sure that you do continue to go in an upwards progression.
You mentioned earlier that you're getting busier every day, and that's a great thing. And that must mean that the word is getting out, and you're starting to get some good referrals from the docs around here, right? We are getting a lot of referrals. We have been full, and then some go home, and we have almost a waiting list to come in. And I cannot wait because I want these respiratory patients to come and see me to see what we're all about. Yeah, and I would say, a little less than 2 months in to say that you're growing by that margin is absolutely wonderful. That's great, and I hope that continues. I know that you're not going to sit back on your laurels. You're going to add some services coming up. Kind of talk about what you want to add to the department, and kind of what your time schedule is for those. So some of the upcoming services that we have are more critical, so they'll be the more critical patients. We want to do ventilator management, which would be patients that maybe were in the big hospital and on a ventilator who maybe have to leave the hospital because their days are up and they need more time, more therapy, and more training and education. And so we want to do ventilator management and bring in those patients. On that same line, we also want to do tracheostomy weaning. A lot of these patients will end up receiving a tracheostomy through their neck. And so this is an opportunity for us to bring those patients in and work with them on a longer term basis to teach them, educate them, train them on how to take care of themselves during the time that they have this tracheostomy. We will be doing intubations. We're working on getting our training lined up. To where the respiratory therapist will be doing the intubations in-house versus having to wait for EMS or the physician. They can be done by the respiratory therapist. Some of the things that we're working on is pulmonary function testing. We've been talking to the clinic about doing it as an inpatient, as doing it also as the outpatient. So we are working on that. That's in progress. The other thing I want to do is we already currently have a cardiac rehab, and we want to open that up to pulmonary rehab, where we keep a respiratory therapist in the rehab with our lung patients as they're doing their therapy and as they're getting stronger, so that we're able to monitor them, monitor their vital signs, and monitor their breathing during therapy and help coach them during that therapy time. So we want to open that up, that pulmonary rehab. And then the other thing, the last thing that we want to do is I'd like to open up a chapter of the Better Breathers Club. There's several chapters in the North Texas area of the Better Breathers Club. It's a club. It's an opportunity for patients with COPD to come in and learn about their disease process, learn about what they can do to help make their lives day-to-day easier. We bring in all kinds of speakers. So I want to bring that out and have that started up so that for the Muenster and the Gainesville area. I've never heard of the Better Breathers Club, but I'm telling you, that sounds like a great idea. And I would imagine that, and pardon the pun, I don't mean to make this pun, but I'm going to. I would imagine that folks who attend that actually breathe easier when it's all said and done, don't they? I think that they do. They learn a lot. I mean, we have brought in things like dietary and physical therapy, and physicians and home health nurses and stuff can come in, and everyone can come in, and they speak for 30 or 40 minutes, and we offer them a snack or a dinner or whatever, but they learn. It's a learning experience. Plus, they also
are reaching out to other people with COPD or family members with COPD that can help them through this.
Well, it sounds great. Again, I think it's a wonderful addition to MMH. I think you're a wonderful addition to run the department, and we appreciate it. Hopefully, we'll get to visit again down the road.
Well, thank you very much.
All right. Thank you very much. She is Andrea Hendershott, and she is the director of the brand-new Respiratory Therapy Department at Muenster Memorial Hospital. That's going to wrap it up for our community service program today here on Hometown Radio, 1580 KGAF.